Good morning. Hello, everyone. Just going to give folks a minute or so to get in this morning. We hope you are all well. We'll give folks one more minute. It's 11:01. All right. Good morning again. Welcome to the third session of our Cause Solution Camp on early childhood. This call will be recorded and will be made available after the session. Please post your questions in the chat. Our agenda this morning includes current industry challenges and a brief product overview, an introduction to Provisio partners, a technical demo, and the reason you're probably all here, an Ask Me Anything session with a Trailblazer. Salesforce is a publicly traded company, and customers should make buying decisions only on the products commercially available. I want to start by saying thank you for taking the time to connect and for all of the important work that you do to support your mission of supporting children and families. I am truly inspired by your resiliency and the work that your organizations do each day. As a former New York City public school teacher and childcare director at New Jersey's largest YMCA, I deeply understand the time and the tears that you sometimes dedicate to your community. Give it a second to load. There seems to be a little delay there. I'm Steph. I'm an account executive at Salesforce.org, where I work exclusively with nonprofit organizations. Before joining Salesforce, I worked in the nonprofit world. I've run private and public childcare centers, and I was a special education teacher. Today, we're joined by Valerie Rogers, a senior solutions engineer at Provisio. Her professional background includes over 15 years working in affordable housing and economic development. I also have the honor of introducing Kim Collins, the Chief Delivery Officer at Provisio. Kim has spent her career working in state and local governments and nonprofits in the early childhood space. In talking with our customers, they've shared how the past couple of years have accelerated challenges that nonprofits were facing prior to the pandemic. Just take a look at some of these statistics. More than half of nonprofits had to change their size, and also more than half shared that it's difficult to balance speed and quality. Since the majority of nonprofits have changed their size and structure due to the demands of services and delivering programs, leaders are often serving in dual roles, taking on responsibilities that didn't necessarily exist before the pandemic. Depending on your state, you may still have restrictions on classroom sizes and program options. Not all of your parents may be back at work, and not all of your families may be comfortable with group care the way they once were pre-pandemic. I know that staffing shortages are also affecting your ability to serve more families. And client expectations are changing as well. The client experience is as important as the services that you're providing. So how can Salesforce help? Whether you're new to Salesforce or an old friend, let's start with introducing Salesforce for Nonprofits. Salesforce.org takes advantage of the core Salesforce platform features to create nonprofit-specific solutions across fundraising, marketing, and engagement, program marketing, grant making, and also drives internal organizational excellence. I know it's not uncommon for childcare leadership to be responsible for all of these areas and lead a staff that keeps dozens or hundreds of children safe and engaged day over day. Salesforce for Nonprofits helps you gain a holistic view of your families and individual children to determine the best way to deliver whole person care with Stakeholder 360. It also provides you and your entire team with real-time program insights that you'll be able to share with funding agencies, donors, stakeholders, local and federal agencies. And when things change, they always do, you'll be able to adapt because you have the power of a flexible integrated system to make adjustments quickly and efficiently. So let's take a look at how human services nonprofits like yours are using the to build meaningful relationships with those in the community. I know some of what you're hearing is available with a few different niche solutions. But the power of Salesforce for Nonprofits is the ability to unify all of your data sources in one place and your ability to integrate with thousands of tools. This gives your team a view of every stage through a connected client journey, a family journey with the Stakeholder 360, from referrals, intake and enrollment, all the way through easier billing, service deliveries, and reporting. One solution, our solution, can help you understand the needs of every individual so you can provide personalized person care, empower your staff to focus on high value activities with individual families and less time on tedious processes, manually re-entering data in multiple systems. Connect those systems to reduce data barriers and accelerate your time to billing, especially as a head start or early start programming. Getting those attendance records and additional reports in sometimes are the difference between that check. Bringing data together in one place to reduce time spent running reports, more time sharing real-time program insights with your funders, with internal stakeholders, all of that can mean additional grant funding available to your team. And using that data to understand how interventions are performing to drive more effective outcomes. Think about the children who need additional services. When you're inputting their assessments and their skills into your system, you're going to see with one quick click where additional services might be needed. And because all of your data is in Salesforce for Nonprofits, this enables you to see how an entire family is receiving services. This means that while a case manager sees an individual client enrolled in employment services or housing services, they can also see their partner in childcare are also enrolled in various services. So Salesforce for Nonprofits is going to allow you to unite all of those data sources in one place, integrating with thousands of tools. And nonprofit cloud case management helps anyone working with your families manage the entire life cycles of services in one single system. Think about your current enrollment or enrollment procedure or re-enrollment procedures. Do you long for a day where you don't have to log into 4 systems to enroll a family? You may be doing this using spreadsheets or paper or different niche tools. But using Salesforce, you're able to track services, case plans, notes, incidents, assessments, outcomes in a single system available from anywhere. Valerie's going to introduce how Provisio is using their industry expertise to support seamless digital transformation to organizations that are supporting children and families and keeping communities strong.
I'm Valerie Rogers. I'm our Senior Solutions Engineer here at Provisio Partners. Before working at Provisio Partners, as Steph said, I worked in the affordable housing sector for the last 15 years. Our organization is a Salesforce implementation partner. We only work with human service organizations. We are a team of about 70 human service experts. We have a lot of subject matter expertise on our team, and we often work in a lot of different spaces in human services, including mental and behavioral health, housing and homelessness, early childhood, which we're going to look at today, and workforce development. And we do serve organizations all across the US, and we have over 160 clients that we've served in the last couple of years. We do provide a variety of different services. One of our main services is that we provide custom implementations. So we do work with Salesforce's great apps like the nonprofit case management app or the program management app, and then build on top of that so that it's really customized to each of our clients' needs. We also provide cause area solutions. One of those we'll see today, but many of our cause area solutions are around housing and shelter. We've built out bed management. For early childhood, we've built out the way to track early Head Start programs. For aging, we've built out EVV systems, and for workforce development, we've built out the way to track all of those employment placements and retention checks. In addition to the services we provide for implementation, we know that it's really important to get your data in. So we do provide data migration and then also data visualization once all your data is in with tools like Tableau. Many of our clients also opt in to do managed services. So this is ongoing support that we provide for org maintenance, training for users, training for admins, just getting people used to moving to Salesforce and then also providing enhancements once they're in Salesforce. Of the many different clients that we serve in the nonprofit sector, here are a couple examples of the organizations that we work with. We do work in health and support, employment and job training, child and family services, which we'll be focusing on today, housing and shelter, which I love since I'm from a housing background, developmental disabilities, and then also ethnic and immigrant centers. So now I'm going to walk everybody through a demo of what we've built out for early childhood. And I'm going to turn my camera off since I've got two different screens. And then after that, we will move on to a Q&A. So 1 second while I pull up my screen. Perfect. Can everybody see my screen? Awesome. I'm guessing that's a yes. So as you can see, we are in an application that we built out called Early Bird. It's our way to track all of those early Head Start education programs. And you can see that we can find that from the navigation panel. You can also search for other apps here as well. This application we have built on top of the nonprofit case management app. So we are leveraging a lot of the great functionality that Salesforce already provides. You can see here for my home page, I can see today's events. I can see that I need to set up an IEP plan with one of the children I'm working with. I have some tasks I need to work on, like I need to call Stewie Griffin's social worker. And then you can also see that I can also see recent records that I worked on. So recent kids that I've worked with, recent parents as well. Salesforce is really great too, because we can also set up additional home pages for each of your staff. So as you're thinking about those different things that you might need to see as you log in, we can set that up for your organization. So first, I'm going to walk through searching for one of our clients. We are working with a child named Marsha Jones. You can see here when I open up search, I can see some of those recent records, but I can also come in here and search as well. So I'm going to search for Marsha Jones and be able to pull up her information. From our contact, Marsha Jones, who's one of the kids that we're working with, you can see at the top that we can track a lot of that really great, easy to find information, including her household account, her parent's name, her phone number, or her parent's phone number, and any additional information that might be helpful to us as well. Something that we've built out for early childhood as well that I find really great is we can build out alerts. So on this, you can see that we have restrictive access. So as you're thinking about when and who can pick up those children from daycare, being able to flag certain individuals that are not able to pick people up, we can put that flag easy to see so that people can scroll down and then see who's not allowed to pick them up, which is really great, especially if you're dealing with kids that have domestic abuse issues with the parents or their parents have lost custody. On this contact page too, you can see that we can easily upload a photo here. So as you want to collect photos of those kids, so you know who the kids are, you can track that as well. And then we also have some great detailed information on the children we're working with. We can see birth date, their age in months, which can be really important as we think about those immunization records, tracking their status within the organization, tracking any of those great demographics that you might need for your funder reporting, as well as tracking allergies and their parent guardian contact information. We know allergies is really important as you're working with kids because, as we know, peanut butter allergies and peanut allergies are things you don't want to mess with. So being able to see that easily in Salesforce as you're working with the kids and dealing with allergies, you can collect that in Salesforce very easily. We can see here that her mom is Mary Jones. We can hover over Mary Jones and see additional information for her and even click on her contact. And then we can also go scroll down here, see any address information, as well as emergency contact and authorized pickup information. So as you're working with those children and knowing who can pick them up, who's authorized to pick them up, being able to track all of that as well. We can also see here that we do have that red flag individual, James Jones, which is the dad that's not allowed to pick up Marcia. So that's a lot of the information that you can see easily on the child as you're working with them and, making sure who can pick them up, and also just seeing a lot of that great background information. So that's our details page, but we also have a lot of great related information tied to Marcia. We can see her relationships to other individuals within the system. We can see that Mary Jones is her mother, that James Jones is her father. We can see any applications or intake she's done in the past, which we'll walk through how to do in a couple minutes. Any assessments that she's had, any service deliveries, any incident reports. So if there's some, issues that you've run into with hitting or biting or just tracking injuries while at the Early Head Start program, you can track all of that in Salesforce. And also tracking those immunizations and medical exams. So as you do those well child visits, tracking those immunizations, being able to see that all in one place very easily. We've also created this button at the top of the page so you can easily create all the different immunization records for the child. And when we click on this, it will create all of those immunization records. So you can see successfully that was created. And then we also know that sometimes children are exempt from immunizations as well. So we do have this button here directly on the contact record where we can go through easily and say certain ones are exempt for certain dates. So we can maybe say these are exempt for this date and put a reason for the exemption. So like no need for booster, for example. And then you can also check off those ones where you have those exemptions. And the great thing about these immunizations that were created is we can build out all those different types, track the statuses and all the due dates. So as you're working with the kids to get their physical each year and track all the different statuses of those immunizations, you can easily track that in one place and know all of the due dates for those. So you can see here that I just exempted certain immunizations. So if we go to our immunization records, we can easily see those show up. Let me refresh my screen really quickly. And my apologies, I just need to refresh it one more time. Should have created all those great immunization records. So now if we go back to those related records for Marcia, we'll see all of those immunizations in one place, see the status of those, see which are not received, the due dates, and know those different types too. So we can also come in here and edit these things as we're working with the parents to track when they get those immunizations done, those exemption statuses if those are exempt, when they've gotten those, the exempt date, and the reason if they don't have that specific immunization. It will also track days past due. So as you're working to make sure that those family members are collecting those immunizations in a timely manner, that you can track all of those. We can also see here that we can click on those immunizations and see additional immunizations that child might need. So this is something we can set up custom for your organization. So as you're working with those different immunizations that are at different time ranges, we can set up the types, we can auto create those due dates and the immunization records so that you know what you need to collect from those different individuals. These are things as well as you're thinking about how do we make sure the parent knows exactly what is due, that we can surface on an experience cloud, for example, so parents can see, here's my child, here's those immunization records that are due, uploading those immunization records, and then also updating those dates of when they've happened as well. So if we look back at our related information, let's look a little bit more at Mary Jones, who is Marcia's mom. If we click on Mary Jones, we can see some great details about her as well. We can see her contact information, her birth date, a lot of that demographic. So as you're working with those family members and tracking if it's a female head of household, race and ethnicity, veteran status, being able to track those things that you might need for funder reporting, as well as employment information. We know often people are sending their kids to childcare because they're working full time. So just knowing where those people are working, how many hours they work a week, so that as you are working with their children, kind of knowing a little bit more about their schedule. You can also see here that we can track that work schedule. So as you're knowing, oh, maybe the mom is at work today, let's call grandma to make sure that if the child's sick, that the grandma can pick up the child, but also being able to track any of that work schedule so that you really know where the parents are and where they might be at any given time for their work schedule. As well as tracking any of that education information or their school information too. So as you're working with these parents and also providing them that whole family services, this is some great information that you can track too, especially as you might be working with them across the board on things like employment tracking as well. So let's go back to Marcia. When we're thinking about Marcia, she is coming in, she's interested in the program. But when she's interested in the program, let's create an application for her. So we can go back to her contact record, go to this related list really easily. And as you can see, these related lists are set up so that as we're providing those services, all this great information is going to show up, and we can easily see all that information on one screen directly from that contact record. So I'm going to create a new application here for our early education. And with early education, we have built in some fields as well, so that as you're tracking eligibility points or documents that you might have to check for eligibility, that can all be calculated in here as well, so that as you're determining, especially if you have a wait list, like who's higher up on the list, or how eligible they are, we can set up those eligibility calculations. If they are submitting information from a community or a web portal, we can also have these applications come in through a form and come in directly into Salesforce. You can see here that since we're creating this directly from her contact record, we can see Marcia Jones. We can find her parent, Mary Jones, track any information that's helpful. You can also see there's a lot of great calculated fields on here, like household size and age, because that's often important for eligibility. And then tracking any details of that application too. So if her mother's pregnant, tracking if she's a citizen, tracking those different eligibility things you might need to collect. So do they have a photo ID of their current address? Are they in child protective services or DCFS involvement? We'll say since the dad cannot pick up the child, that there's some DCFS involvement. And then also tracking some of those inquiries as well. So where did the application come from? What location are they interested in? Are they interested in other locations? So as they're, getting and finding a location that's close to them, being able to know which locations they're interested in, how they heard about you. So maybe they just walked in. And then also tracking any of that eligibility information. So if they are receiving any outside benefits, and tracking things like poverty guidelines and income eligibility is built in as well. So there's a lot of great fields on here. We build this out as it's often things that need to be tracked for early Head Start programs. So you can easily see that we can track all the things that need to be collected. So we can track that proof of eligibility, what we collected, those age verification documents, and anything that's relevant to that child. When we save this application too, we can also come in here as well and see how that filled out and see how some of those fields are being calculated. So we can see that they've got 40 eligibility points, which is based on the formulas that we have below. And you can also see any of that additional information on that application, as well as track the status. So, this just came in, we'll say, from a walk-in, we can track that we still need to be able to track documentation, track if they're on the waiting list, or say that we're ready to do an intake for this child. We know often with these programs as well that you do have to track a lot of signatures on documents. So we can auto create those documents so that as you're getting certain waivers or certain photo releases, being able to populate those in Salesforce and collect that information and even collect those parent signatures so that you have everything in Salesforce to make sure that you're compliant. I'm going to go back to Marcia Jones and we're going to walk through creating an intake. Now that we've got that application information, we can track a couple more details on that child as part of our intake process. You can see in Salesforce too, there's a variety of different ways to do intakes. There's different record types. We can also come in here and track additional information on that child, track the intake date. Because now that we've gotten that application, we can fill out more information about what they're interested in. We can see we can pick the school name, the classroom. So as we're really getting that child set up to track all the information they need for their class and get them set up to be part of that class, we can track that here. As well as tracking doctor information. So we know often kids can get sick. So, being able to know that address information really quickly so that as you are working with those doctors or making sure if somebody gets sick really quickly, knowing who to call. For those of you that are newer to Salesforce, one of the features I really like about Salesforce in general is that you can require certain fields. So especially with programs like this, you can see anytime there's a red asterisk next to a field, that means that it's a required field. So this is a great way to make sure that with your staff, you're collecting all of that information that you might need as part of the program, so that it makes it so that staff can't save these records, for example. I'm gonna you can see if I don't fill out this field, it's gonna remind me, nope, there's still some fields that you need to collect to make sure you're collecting all that great information for those programs. I'm not going to fill out all of the fields here, but you can see that there's a lot of great health information, tracking behaviors, as well as tracking social behaviors. So as you're working with that child, making sure that you're providing them with the best services possible. In our example, the application and the intake went really well, so let's enroll her in our program. Since we've built this out on top of the NCCM application, it's important to note that a lot of these objects or tables, as we think of them in Salesforce, come with that NCCM application. Things like tracking intakes, doing those assessments, tracking service deliveries and program engagements. These are all things that come natively with the NCCM app, and then we've customized it on top of that to make sure that it works for different programs. So in this example, we're going to enroll her in our Early Head Start program. We can track her as active. We've got Marcia Jones in there. We can track her household account as well. We can track that program. So we've got our early childhood program, and then track things like the funding sources. So if she's getting any early Head Start funding to help pay for her services, she can connect that easily here. And we can track the agency that she's with, the start date, for example, and the end date. So let's pretend she's going to start early September. As we know, all school's starting, and then we can easily save that information to make sure she is enrolled in the program. So with those program enrollments, if we dig a little bit deeper into program enrollments, you can see here that we can track additional information for the child. You can see what classes she might be part of, if she's got an action plan she's working on, any of those service deliveries that you're doing. So if you're providing her with a backpack or school supplies, being able to track all those different ways that you are serving that child, as well as also uploading any files. So if you've got an agreement you sign with a parent, all those different files can be uploaded so you have everything in one place. So let's dig a little bit deeper into what it looks like to do some classwork with children. We can come in here and use the service schedules object in Salesforce. This is a great tool that has been built out already to track classes. So you can see here that we can create a new class. And it's really easy to create new classes. It's just a 4-step process, and it walks you through how to do everything pretty seamlessly. So we can come in here and call this our Head Start program. 2022, we can tie it to a service. So we can say, we're going to tie this to our Early Head Start program. You can track any of those service providers. So as you're working with different contacts that are running those rooms, tracking those people, tracking capacity, which we know is really important as you're working with children to make sure that you're not overbooking those rooms. And then tracking, are you giving them breakfast? Are you giving them a snack? And are you giving them lunch? So as those kids are in those programs during the day, being able to see those different meals you're providing. We can also see that first session time and even track the frequency. So if you are providing these daily or weekly, you can track those dates that things happen. We're going to say that we are going to track this and everything's going to end at the end of May, and we want to create classes for all of those dates until the end of May. And let me go back. I think I just ran into a quick error. We can see as well that if there's already kids in that program, we can easily add them all from that list. If you end up having more than 12 children, you'll run into an error saying that there are too many kids signed up. So we can easily register those kids for the class. We can create those service participants and create that class easily. So now if we go back to one of those classes that we already have, we can see any related information that's important for that class. We can see those service schedules. We can see those service sessions. We can see all those different dates that those are happening. We can even drill down and see more information for that class and all those service sessions that are happening. So as we have this class going from August until May, being able to see all of those dates. We can also see from here as well that we can track attendance. So as we track attendance, we can see all those kids that are in the class. I can come in to see those dates that are in there. I can track attendance for kids that are already registered. In this example, I just picked another class that I had where I've got Stewie registered. It's automatically going to pick up that attendance, say they're present, but you could also come in here and say they've got an excused or non-excused absent. And when we click submit, it's also going to track that attendance as a service delivery. So this is really great in Salesforce. Any service you're providing is all going to be on the same object called service delivery. So this is auto going to create a service delivery, which is really great. So as you do those counts at the end of the year across your programs, especially if you're not just working in early childhood, everything's all in the same place so that you can count things really easily and show your impact measurement. We can also go back to our early childhood class as well and be able to add more participants because maybe you had a couple of kids move around to classes. You can delete future service sessions, like maybe one of your classes just didn't fill up and you actually want to cancel it for a certain period of time. And then we've also built a class sign-in sheet. So as you're working with those kids, being able to create a sign-in sheet, which you can easily print so that you can track the arrival time, the signature from the parent, the departure time, the signature from the parent, and track who picked them up. So this is really great as well, because then you can easily track all that information and have that physical paper that you might need for your compliance records. Another thing tied to these classes as well is you might be providing different assistance during that. So we can track any class assessments that you might be doing at that time, any first aid kits that you might be giving out, because we know sometimes, things happen in the class. So we can track any of those first aid kits that are provided and who they're provided to. And then as we think about those class assessments, any assessments that you're doing as well as part of that class, you can track here too. So you can see we've got our toddler class. We can do that assessment in here. We can track the teacher. So as we're tracking, who is this assessment on? And then tracking any of that additional information that might be helpful as we do that assessment. We know as well with Early Head Start that you might not just be doing the classwork, but you might also be providing additional services. So Salesforce has this really great functionality called bulk service deliveries. So we can easily create service deliveries for children and make sure that as we are providing additional services that we can track that either by the group or the individual. I really like this as a case manager because you can go in at the end of the day and say, I gave away 5 backpacks, I gave school supplies to these 10 kids, or even I had 5 counseling sessions with the kids I'm working with. So we can come in here and create these by group. You can see that based on the program, we've already got those services created. So I could say I had a counseling meeting on this date for an hour. We can easily select those kids that might have been involved in counseling for the day. And this is going to create a service delivery for them really easily. Salesforce also allows you to have different units of measurement for the services that you're providing. So I can also come in here and track for Marcia Jones for her early childhood program. We also provided her with a backpack, which was 1 bag. And let's say we also gave her school supplies today as well. So this makes it really easy at the end of the day, or whenever your case workers want to work with the kids, to be able to easily put everything in and track all those service deliveries. In addition to all those service deliveries, we know it's important to be able to track any medical assessments and well child visits. So that is also built into our application as well. And also being able to see all those different service deliveries in one place. So if we go back to our contact we were working with, Marcia, we can see once again related information. So as we're working with her, we can see all this great information starting to fill in. We can see that application we got, that intake we got, any of those service deliveries. We saw that we gave her a backpack and school supplies, that program engagement, any referrals she might be getting going outbound, all those different immunizations and those medical exams. So we can come in here and track things like a well child visit as well. So as you're doing those different visits, tracking all of that detailed information. So we know that Marcia is in our 4-year range. We can track the date of that exam, track any diagnosis that she might have gotten. Let's pretend she's got asthma, and then track the status of those exams. So that is, you need to track that for the different agencies you're working with, being able to easily see that in Salesforce as well. One of the other great features that we've built out for early childhood is the ability as well to, on their program engagement, review any service deliveries that you've provided. So you can see easily here that we can filter by different date ranges, by different record types. So if you want to see the most recent child visit or the most recent home visit or mental health visit, seeing that all in one place so that you can easily print this information and drop into their larger file, or if you need to get signatures and dates on certain of these for different approval processes, that is built into the system as well. So what happens when you get all this information in Salesforce? So just to kind of highlight what we've walked through a child coming into the program, tracking all of the application and intake process, enrolling them in the program, having them in Head Start, and tracking the attendance that you might be provided and any of those meals you might be providing, those different service deliveries, as well as being able to really manage that family and see all of the information that might be important to you as part of that program to make sure that you are really serving the child and the parent in a great fashion. But what happens when you get all that information in? There's some really great reports that we've built out already in Salesforce. So we know, especially with early Head Start and Head Start programs, there are very specific reports that you need to do. We've created all of the PIR reports that are required as part of the reporting process. So we know that those need to be done by those different programs. So all of those reports we've built out into Salesforce. And when we drop in a cause area solution like this, a lot of this is already built out, and then we'll tailor it to your needs. So really kind of starting at a great place where it doesn't have to be built out every single time, but we can really leverage what we've already worked with clients, and then also be able to easily adjust that to your specific needs. We can come in here and see some of those Head Start programs. We can see all those funded enrollments, for example. So as you're collecting those different PIR reports, everything's built in here so that you can easily have all that information that you might need for that report. Salesforce also has the ability to track a lot of additional reports as well. So as you're working with your agency and need to track one-off reports, you can also track that as well. We can also come in here too and see who our partners are. So if you're a larger organization that has subdelegates, being able to track the different partners you're working with is also possible in Salesforce as well. And then all these reports in Salesforce are really great too, because you can easily go in and edit them. So I just clicked into one of these reports. I can easily click edit. We can drop in additional fields if we need. We can see all the columns that are in this specific report and easily be able to drag and drop in new fields. We can also move things around, add additional filters, so that as we're thinking about those different things we might need to report on, be able to pull that really quickly. So I'm going to close this one and discard it so that we don't save it. But reports are great because they are often a lot like Excel. In Salesforce too, you can subscribe to reports. So if you want to get a specific report at a certain cadence, that can be easily provided. But reports can also be seen in a very visual way. If we click on dashboards here, you can see that we have created some dashboards so that we're easily able to see all those applications that might have come in the last week or two, so that as we're providing these services, seeing what applications we might have, what the status of those applications are, if any of those applications are coming in from our portal, because we have built out those parent portals, and then also seeing who's a recipient of specific government funding sources, so that as you're working to report on some of those things to your funders, being able to easily do that. You can also subscribe to dashboards as well. I really like this because as you're working with executives, it's great to be able to just send them the information that they might be asking you about frequently. And then any of these reports too, or any of these dashboards, we can also dig into the reporting as well. So I know that was a lot of information and just kind of walked you through some of the things we've built out for early childhood. I do want to highlight, we have built out parent portals so that parents can update their kids' information, update those immunizations, upload any of those eligibility documents or any documents they might need to as part of the program. And then also, as we work with larger agencies that might have subdelegates, we've also built out the delegate portal so that as you are working with those additional agencies, being able to have those outside contractors you might be working with or partners be able to submit their information so you have everything in Salesforce in a seamless way. So that is all I had to show on the demo. I think we are going to move on to questions. So if anybody has any questions that they'd like to ask, we're more than happy to answer any questions you might have.
All right, we have a question here in the chat, and it could be for Kim or for Valerie. What should childcare leaders consider when first starting their journey with Salesforce?
I can answer that one. I think Salesforce is really great for organizations as being a single source of truth. So if you only have early childhood, that's great. You can move everything into Salesforce and have one place to do all of your great reporting. Or especially if you're an agency that provides a lot of different services, moving everything into Salesforce is great because then you, as Steph said earlier, can really track that holistic way that you're working with the family. You might have the child in early Head Start. The mom might be in your employment program. They might be living in one of your transitional housing units. So having one place where you can easily see all that contact information and all the different ways that you're serving people is really important. I also think as you're looking at different systems, it's really important to find a system like Salesforce where the reporting is easy. Because yes, you can track information, but you really want to be able to get it out in a way that makes sense and a way that's easy so that you're not spending hours upon hours creating the reports that you might need for your different funders.
Awesome. Kim, did you have anything to add to that?
As someone that chose Salesforce within an early childhood organization, to Val's point, two of our main things that we wanted to accomplish with Salesforce was one was absolutely reports and making sure our comprehensive reports were there. The second was because we were an organization that did more than simply direct service of Head Start. We had multiple funding sources. We had multiple funding streams. We had a variety of other services as well. Salesforce was able to accommodate all of that in a single platform.
Awesome. Thank you. What types of information, talking about reports and that kind of thing, what kind of information are you seeing childcare leaders specifically looking to track, maybe outside of the traditional, grant funding type of information?
That's a great question. I think outside of the traditional items like enrollment and classroom and attendance, we've also seen reports on, chronic absenteeism and looking towards parents that have participated versus those that haven't, and crosswalking that with attendance, and thinking about, well child visits, especially during kind of some of the awkward times in COVID, making sure that kiddos were still seeing their physicians as they needed to, immunizations, things like that.
That's awesome. I think those are really innovative ways, and probably ways that some childcare leaders don't even realize they're spending a lot of time manually doing some work. It really sounds like there are very intuitive ways to ensure that nobody slips between the cracks, whatever
Absolutely.
that might look like. Yeah.
Well, and I think the other key that we found was by having a household model, you're able to track siblings, right? And understand kind of the impact of one sibling's attendance on the other sibling's attendance, and really being able to serve that whole family, and trying to find, if one kiddo is having some challenges with illnesses, how can we support that family to get the other one still to childcare?
I think building on top of what Kim's saying too, having everything in one system and being able to see the whole family is great as well, because that's where you can also, once you have all that information in there, start to predict services people might need. So if you're seeing those kids that might have more truancy, maybe you have ways to help people with rapid rehousing and helping with rent, so that if their non-stability in housing is what's causing them to miss class because maybe they have to shuffle around at different places, or even, maybe you provide assistance with providing old cars because that's the hard way to get to class. Being able to, see that information and those different needs that people might have in Salesforce, and also kind of track that with the information you're already tracking in Salesforce, can be really helpful when you're serving the whole family.
That's an excellent point, Valerie. All right, a question here about development and fundraising teams. Is it typical that a fundraising or development team could benefit from getting a childcare program on Salesforce?
Oh, absolutely. Being able to pull reports and be able to provide funder information or impact reports, all from one place, deduplicated counts, right? It's so hard to know what kids are in which classrooms, and if you have multiple funding streams, not counting those kids twice. Being able to kind of have self-service reports for the fundraising and development team is huge.
That's awesome. Any tips around engaging a childcare center, early head start center with a marketing solution? What would that look like?
Do you want to take that one, Val, or do you want me to take it?
Yeah, I think with early childhood groups and also childhood groups in general, we're often seeing that when they're engaged in other programs, they can also be eligible for other programs, and it's hard to know that. So making sure that you're using, we have an organization we're talking to right now where they know that their parents are in their fatherhood program, for example, but they don't know the kids are eligible because there's, specific information that might need to be collected there. So using that to be able to provide additional services can be really great, as well as making sure that you're marketing to the right people. So being able to create that list of they're in one program, but they also have a 5-year-old child that doesn't look like they're in a program right now. So being able to create those targeted lists so that you can engage those clients you might be working with, and making sure that you're serving them in other ways, and also just letting them know of the different services you provide through something like Marketing Cloud or Pardot.
Excellent. Kim, do you have anything to add to that? How a childcare leader might engage with some Salesforce marketing tools?
Sure, sure. I think another one is, trying to get families involved in the parent policy council. So sending out information from the policy council, being able to send periodic newsletters and things like that through a marketing tool is also really helpful. The weekly menus, things like that, automating all of that so that it's not, oh, did you remember to send that email out? Being able to automate it is really helpful.
I think even using those emails too for reminders to parents. So like your child needs an upcoming child visit, or your immunizations are about to expire. So kind of using that to point them to, for example, the parent portal so they can easily upload that information.
Yep.
Yeah, absolutely. That's a great point. As former childcare director, we definitely had binders upon binders organized by the child's birth date or their immunization record date, so that we could go to the January binder and see all the kids that we needed to get in touch with their parents at drop off or pickup. And that automation would have saved us so much time, but also would have reduced any human error, right, around some of that. And I love what you said, Kim, about newsletters and weekly menus and those kinds of things, just keeping parents engaged in what's going on at the center. And then Valerie, to your point about ensuring program eligibility in other places that could really change the support services around a family. So many of our nonprofits that we're working with are providing such robust services for families to really keep those communities safe, keep families together. It just makes sense to be able to see everything in one place. We recently spoke with a nonprofit that does referrals from their food pantry to their other services with a Post-it note. You get a Post-it note with the office number that you're meant to go to and who sent you. And there's no way to track those referrals if they're not using, they can't even speak to the data because they're not tracking it yet.
That sounds familiar
right.
to the nonprofit I worked at. We had lots of Post-it notes that would often get lost. I think it's important to note, we did not demo it today, but we have created an eligibility calculator, which I really like. I'm a former compliance person, so the person that had to look at all the funding requirements and see eligibility for things, and there's not a single person that can remember all of that. So we've created an eligibility engine where you can easily put in all those different rules for the funding sources and be able to quickly see based on demographic information, federal poverty level, income, family size, what different programs people are eligible for, so that you can easily shoot a referral to your other internal team members as well.
Excellent. We have time for a couple more questions. I've got one in the queue here. So if anyone in the audience has some more questions, you can send them through. The one I have in the queue here is about the families. Valerie, I know you had talked a little bit about the portal that a family could use to update immunizations or, even to register potentially for a program. But maybe talk to us about other ways that families might feel the difference of using a system like this.
I like the family portal as well because sometimes you get a new cell phone number, even just updating your contact information, it makes it really easy to do. So that you can make sure that you're contacting the right people, or even updating who's an authorized person to pick up, because maybe grandpa just moved to Chicago where we live, and grandpa can now pick up the child as well. We also see with portals as well, a great use case for portals is case plans. So as you're working with those children on different potential milestones, assigning certain things to the parents and kind of being able to surface that to them so they can see, okay, we really need to work on motor skills. And, our goal is to write our name 5 times in the next 6 weeks, and being able to have that parent just easily say when they've completed those things. I also like having the case plan in a portal as well, because we often talk to organizations, the second the client leaves the office with a paper case plan, it's lost. So they don't know where it is. They don't know their next steps. So having a place where they can easily pull that up is really great. As well as we've also, you can also surface up where class locations are, what time they're at. So just reminding the parents, your child is enrolled, you're in room B, this is your location, this is the time it starts, here's some additional information. So that as they're, seeing what classroom their kid is in, it's all in one place and it stays there so that they can easily access it.
Yeah, Steph, the other really great use case that I personally have found really useful is being able to take your kid to the doctor, take a picture of the physician form, right when in your car or still in the office, and upload it directly into the portal, so that it's not something that then you have to remember where that paper is, remember to take it to the center. You can just take quick pictures of, the physician visit forms or pay stubs or whatever that is, and upload it directly into the portal and not have to remember to bring paper copies to the center.
That is great. So we have 3 sort of specific questions that came in. 2 are around the parent portal. So can parent teacher conferences be done through the portal? Is there a video component that can be added to the parent portal?
There certainly could be. I think as what Val demoed wasn't, but that's certainly a add-on that we could do without a doubt.
Cool. Along the same line. Oh, sorry, Val.
I was saying, or even being able to see slots where you could sign up for your parent teacher conferences. That's another great use case for the portal. So people could see those slots that are open and sign up and at least know, like, hey, here's the Zoom link that you need to click into if you're doing those virtually.
Cool. So that actually is part of the second question around scheduling. And would a calendar reminder go to Google Calendar or Microsoft Calendar or something like that?
That can definitely be set up as well. So Salesforce also has the great way to use Salesforce Inbox. So if you use Outlook or Google, being able to connect those things. I also like leveraging those tools as well, because you could still stay in your Outlook and send emails and use email templates, but it's also going to connect to Salesforce as well. So you really have that one place where those parents can, or where the teachers can see all the communication they've had as well, which I think is really important, especially as you're thinking about, hey, how did we deal with this issue with one kid one day? Oh, we had that same issue with Sally. Let's see how we dealt with it. Being able to go to that other contact, see the different steps you've taken with incident reports or emails is a great way to make sure that you're serving clients kind of the same across the board.
That's excellent. That's great. All right, with a couple more minutes here, the last question that we have here is around the form. So Kim, you had mentioned uploading the pictures of forms. What does that look like on the back end for the provider when they are, can they look at forms all in one place? Are they looking at it in each household record? Talk to us about what that looks like, and can they print them?
So generally they're uploaded as PDFs, and so then they're connected to a specific record in Salesforce. So how we, map it is kind of dependent on each individual use case, but it could be connected to the child's record or their visit record to make sure that it's all where it's appropriate for how each organization does their work.
Excellent. Is there a way that you could easily run a report to scan and see who maybe didn't upload a document? And then what if they don't have access to a computer? Can someone do it for them?
We've also set up document checklists, I think is an important thing to note, because certain like waivers and things expire after a certain amount of years. So you can even create like the due dates on that contact record and have them flash up when those are going to expire. So health insurance, other programs we work with, sometimes you need driver's licenses or insurance. So having that all in one place. I think as we're thinking about how you serve clients that are probably not as tech savvy as well, and not everybody's got a computer or has access to a portal, there are ways in Salesforce that staff can log in as that person directly and be able to upload those documents for them, or even just connect them directly in Salesforce.
Excellent. Perfect. We got a message here from Kyle saying that he could see a lot of use cases here for a summer camp. So definitely agree. And as we get to the top of the hour, thank you all so much for joining us. Thank you to the team from Provisio for creating such a cool demo so that we can see what is possible. This was a part of a 3-part session that Salesforce.org ran with Provisio, and we are excited to send out the link of the recording when we have that available. And please reach out with any questions to either myself or the team at Provisio. We look forward to connecting with you all soon. Bye, everybody.